My name is Amanda. I am a professor from FUMEC University. Okay. Today I will talk about an application of natural language processing and ontology to electronic healthcare records in the field of gynecology. Acho que eu passo, Eduardo. So the research background is about the electronic healthcare records that are an essential source of real-world health information for several purposes. For example, treatment, to epidemiological studies, to find patients, to include in clinical trial and others. Information in the electronic health records is often recorded in an unstructured format, which poses a challenge to use it for computational purpose. Therefore, an effective means of connecting the ordinary terms found in EHR with standard medical terminology could improve information retrieval process. One option to this problem is to map the EHR terms to standardized terminology or clinical terminology. Oh, sorry, I come back. And our investigation draws on a study by Schulz et al. 2017, who analyzed terminology standardization and proposed a methodology to connect three types of clinical terminology. They are: one, interface terminology, namely medical chart, medical notes, or medical jargon, the electronic health records. Second, reference terminology, which are controlled vocabulary and ontologies. Three, aggregation terminology, which includes the International Classification of Disease and SNOMED CT and others. So our proposal, the gap posed by Schulz et al. 2017 requires to find a way to connect the clinical data in the electronic healthcare clinical text to standardized clinical terminology. So our principal contribution in this research is verify medical jargon, that's terms that do not correspond or also correspond to the Ontonian ontology. This is a reference terminology. And verify medical jargon terms that not correspond or also correspond to ICD-10. This is a picture about this mapping that we try to propose here. These are the clinical terminology that you use in this research. Ontonian, this is an ontology of obstetric and neonatal ontology, ICD-10, and the controlled vocabulary, MESH, and the translated to Portuguese text, that is this descriptor healthcare science descriptors. So our methodology. First, we apply natural language process techniques and ontology. For example, Ontonian. We apply a natural language process to extract signs and symptoms from the clinical notes. We use about 32 evolution and anamnesis from the electronic healthcare. And these notes were anonymized. It's from the Gynecology department during the year of 2018. And of course, we ask for the ethical approval by the local committee. So that is the figure that summarize our methodology. And first here, the notes from anamnesis and evolution from Gynecology department. We need to do a pre-list of the terms of signs and symptoms to to train the algorithm. And to do this list, it was important to use gynecology guidelines, and we also have the support of the medical team, the local physicians. They helped me to create this list to make possible to train the algorithm to find signs and symptoms. Then we apply natural language processing with Python. Then we analyze this structured term about the related frequency and percentage of terms. And then we try to map to ICD-10 and Antonio. To do this mapping, it was important to use a norm called ABNT. This is a pattern, a normative about health informatics principle of mapping between terminology and system. And after this, the physician support to validate the correspondence, the map between the terminology. And finally, we have this product that are the symptoms and signs and symptoms. So they are the step for the mapping. First one, document the mapping process between clinical terminology. Second, verify the semantic equivalence between terms. Third, you use a source mapping for the term with multiple synonyms. Four, analyze risk factors and document ways to ensure consistency in the mapping. Five, clarify the meaning and fully use the form of the abbreviation in the interface terminology. That is a problem. We found 6% from the notes were just abbreviations. And sometimes it's very difficult to understand this medical jargon because it has a lot of abbreviation. And because of this, it was important to work together with the physician to clarify this kind of abbreviations. And six, map the target terms to the reference terminology, select from DEX and MESH. They are the same, but one is Portuguese and MESH in English, and Antonio Ontology. And seven, create a map table to demonstrate the types that of interoperability verification that are based on the ABNT normative that are one term for one term for many terms for one term, many terms for many terms, and do not interoperate. This is the table of mapping of the terms. So when interoperate one-to-one, the relation is a single source class is linked to a single target class of term. Then the decision was to retain. But when you have a not of kind interoperability, one term to many, many terms to one, many to many, we have the decision to define a class according to the basic form ontology, BFO, and chose the term that poses no clinical risk. This is according to ABNT ISO. This is the main results that we retrieved from natural language processing. And the most frequent terms were bleeding, pain, discharge, dysmenorrhea, itch, edema, nausea, and others. You use a word cloud to represent the most frequent terms within the notes from electronic healthcare. So this is the example of the correspondence, the mapping between the clinical terminology. Here are the terms that we found in the notes from electronic healthcare records. Here's the terms that we found in Antonio, this column, and here DEX, MESH, and ICD-10. We can see here the term irregular menstrual cycle has a correlated in Antonio index, but not in ICD-10. item has a correlating, the term item is absent in the ontology, but has in DEX and also ICD-10. Dysmenorrhea has the terms in the three kinds of clinical terminology. And painful urination, we have the term correspondence in Ontonil, but we don't have in MeSH, and has also in ICD-10. This is just an example. In my research, we have the complete table with all signals and symptoms and other kind of extraction of them that we did, diagnostic, prognostic, abbreviations, and others. So this is the mapping from interface terminology terms to reference terminology on Tonil. We did this step first. Reference terminology to, interface terminology to reference terminology. What you will find? Interoperate one-to-one term is about 20% of kinds of signal in cyclones. And non-interoperable is about 60%. We have more terms that do not operate than terms that operate one-to-one. And interoperate many terms for one term is about 13%. Then we have 133 kinds of types of signals in symptoms. So this is the map from interface terminology to aggregation terminology, ICD-10. We have interoperate one term for one term, it's about 30%. It's almost the same as the previous one. And non-interoperable is about 53%. And the other is less. Interoperate many terms for many terms, just 3%. And we find 143 kinds of signs and symptoms that make this mapping. So some limitations that we found in the research. This research, we described some different syntax and semantics that pose obstacles to achieving interoperability between clinical terminology. Each clinical terminology has your own syntax. That was difficult to find the correspondence between the terms. Then the physician need to help me in this point. Also, the ontologies about Ontonil. To reduce this difference, we propose to use an existing knowledge representation source in the information library field, and also the assistant of clinical medical librarian, because I am a clinical medical librarian, then I think we can help in this, helping using synonyms and things like that. We identify several issues with spelling, punctuation, and typography errors, and then analyze text from the electronic health record, records. Was very difficult to analyze the clinical notes from gynecology because we have a lot of errors in spelling, punctuation, and variation of terms. This was an issue. And final considerations, we modified the second step of the proposal by Schulz et al. 2017. Instead of the reconciliation step between reference and aggregation terminology, we map reference terminology to aggregation terminologies. Yes, this modification was necessary because we focus on analyzing the mapping between interface terminology to the other clinical terminology, reference and aggregation terminology. We focus on interface terminology. This is our main focus in this research. And the medical jargon, called here by Schulz, interface terminology, used in clinical practice, proved to be different and distant from standardized terminology such as ontology, reference terminology, and even from ICD-10, aggregation terminology. And we use ICD-10 because in this hospital, the physician use ICD-10 when we don't use SNOMED. A primary difficulty in analyze the medical jargon used in interface terminology, namely its epistemological aspect. The medical jargon is embedded of a much epistemological aspect, which depends heavily on the medical context. And the physician says to me they use a lot of abbreviation, and those in sometimes other gynecological team can use different terms describing prescription and evolution, things like that. So then it's very difficult to analyze this natural language. Thus, ontology is an artifact that should be used and seek a solution to this difficult to make more easy this interoperability or this mapping. We should use ontology to help to have a better electronic healthcare notifications and things like that. So this is the reference from my research, and this is my contact. And any question?